lots of things going on this fall. Of course, we got football season going, pumpkin spice is in full swing, Halloween is even on the horizon, and this fall, more than 67 million Americans on Medicare will face one of the year's most important healthcare decisions. Open enrollment. We all know about it, or if not, we got you covered today because a new national poll from the PAN Foundation's Center for Patient Research sheds light on the biggest concerns patients are facing when they consider their Medicare coverage. So joining us to break it all down is Amy Niles. She is the Chief Mission Officer at the PAN Foundation. Amy, we're bringing you on to the show now. Welcome to Inside South Florida, and tell us, what is Medicare open enrollment and what should people really know about it?
Thank you for having me. Medicare open enrollment is a critical time of year when people on Medicare compare plans, including prescription drug coverage, to find that plan option that best meets their healthcare needs and budget. Now, we know plan costs and coverage can change from one year to the next. Individuals' healthcare needs and budget can also change from one year to the next. It's why it's so important for people on Medicare to take time during open enrollment to evaluate their plan options. Now, open enrollment begins October 15th. It goes until December 7th. Any changes that are made during this time period will take effect on January 1.
Now, we're learning every single day on what we can take away from the studies that you guys are up to. So PAN's recent poll actually reveals some surprising findings when it comes to Medicare open enrollment. What stood out to you, Amy?
What stood out is that 1 out of 2 people on Medicare told us that they do not plan to evaluate their options or change their plans during this open enrollment period. This despite concerns about growing costs, increased premiums, increased deductibles, out-of-pocket costs. This concern is exactly the reason why people on Medicare should take time during open enrollment to evaluate their options.
Amy, tell us, what are maybe some tools or resources that are available to the community that they should be paying attention to as well?
Yeah, first of all, listen to yourself. See what your own healthcare needs are and what your budget is. What are your medication needs? What healthcare providers will you need access to? From a budget perspective, what will you be able to afford in terms of premiums and deductibles and out-of-pocket costs? Also review that annual notice of change that has come from your plan, because that document identifies the changes in your plan currently from this year to the next.
There you go, Amy, helping us pick the right plan that is perfect for us. So we appreciate your insight and info there, but we know there's more we can get our hands on. So where can we go for more information?
Yeah, for more information, people can visit panfoundation.org/open enrollment. There's also another important tool called Medicare Plan Finder, which can be found at medicare.gov. And this is an important tool because it allows people to evaluate the plan options in their area.
There you go. Amy Niles, thanks so much for joining ISF. We appreciate your time today.
Thanks for having me.